The most common concern presenting to outpatient mental health professionals who serve youth are hyperactivity, inattention, defiance, and aggression. On today's edition of Mental Health Matters, we're going to be talking about this group of children and adolescents. Hello, my name is Dr. David Palmer. I'm a professor of psychology here at Marywood-University. I'd like to begin today's edition by introducing my panel. To my immediate left is Dr. Carl Schuster, who's a very experienced, knowledgeable clinician practicing in Peckville, serving this group of children nearly exclusively. Next to Dr. Schuster is Miss Megan O'Brien. Miss O'Brien is a junior undergraduate psychology major here at Marywood. Next, we have Dr. Amy Kurkovich, who is an alumni here at Marywood, who is a doctoral level clinical psychologist practicing in Clark Summit. And last but not least, we have Dr. Stu Badner, who's an associate professor of practice here at Marywood and also directs our school psychology program, who will be giving us interesting perspectives from a school perspective. Okay, thank you all for coming here. So let's begin with, we're really talking about primarily three diagnostic categories today: ADHD, oppositional defiant disorder, and conduct disorder. So let's start with ADHD. What is it? What isn't it?
Well, I think the most common thing that people think of when they think of ADHD is the high activity level and the impulsive behaviors. Those are certainly the things that are going to get the attention of parents, teachers, and it's much higher activity level than the average student, and a lot of impulsive actions, doing things without thinking, that type of thing. The other big cluster, of course, is the inattentiveness. So that would be distractibility, not following through on tasks, forgetting things, that sort of those sort of symptoms.
What kind of things do you hear out there that where people think a thing is ADHD but it's not ADHD? What kinds of misunderstandings do you think there are?
One of the common ones that I've heard sometimes people say is they think it's just a lack of discipline, or it's a lack of parenting or something. And when you try to explain that these are neurologically based things, it's not anything that anybody's doing on purpose. That's, I think, very, very informative and helpful to them to understand that it's not an intentional thing. When we're talking about the hyperactivity, impulsivity, particularly with ADHD, generally they're not setting out to do that on purpose. These things just kind of happen.
What do you guys make when you have someone say, "Well, he's just that way at school. He's not that way at home"?
So, typically with ADHD, kids can attend, or individuals can attend to things that they might be interested in. So you might see them be able to sit for a long period of time if they're interested in that. Because when you're thinking about ADHD, Call of Duty, Fortnite, all of those things, they can play video games, they can do all of those types of activities. And so there might be a misunderstanding among parents. Well, he can sit and play that for hours, or she can sit and play that for hours, but she can't do her homework. And really, when you're thinking about neurodevelopmental disorders, you're looking at the reward systems in the brain, right? And so with kids who are a little bit neurodiverse in these areas, you're going to see differences between, especially if they have a sibling that's not affected by ADHD or not affected by these symptoms, you might see comparisons, but remembering that their reward systems are different than other kids.
Okay, let's segue, and we'll come back more to ADHD, of course, because it's so mysterious and complex sometimes. But let's talk about oppositional defiant disorder. What can you tell our viewers about that?
Well, I think one of the most distinguishing factors there is that the child is typically not following rules, things that adults or other authority figures tell them, and doing it repeatedly. In other words, it's not just, oh, I forgot that rule and okay, next time I remember it. But you see there's some intentionality there of, I'm going to do what I want to do, and it doesn't matter what the authority figure says. That's certainly something that stands out, that there's a deliberateness to it and a repetitiveness. That's not just one time and then you learn from the mistake, but it keeps coming up.
A lot of times we'll see that kind of behavior in school settings, and along with the symptoms similar to inattentiveness or hyperactivity for ADHD. And a lot of what we do is explore that a little bit deeper. what might be behind that. And it could also be associated with learning problems that we often see. So when we do comprehensive evaluations, that's something that we'll be looking for as well. Perhaps some of that opposition or defiance or not wanting to do a particular task is related because they're having difficulty in school.
So then, how does oppositional defiant disorder compare and contrast to conduct disorder?
Well, I think the defining feature of conduct disorder is when the defiance and the behavior problems start to violate the rights of others. That's the way I often explain it to parents, is when you start to see a child doing things like deliberately marking up the desks at school, deliberately destroying property, or violating the boundaries of others, pushing, shoving, when you get to the point where you're doing those types of things, then you've kind of escalated to conduct disorder. And it can even obviously then spread to the community where they're out doing things in the community. Maybe there's some minor shoplifting or other kinds of behaviors that again are not appropriate and that could get them in sort of some misdemeanor type trouble. Now you're kind of escalating to conduct disorder when you're violating other people's property or other people's rights.
And you'll tend to see that trajectory where you'll see oppositional behaviors earlier on, and then it will escalate to conduct disorder.
So what a headache is to a migraine, oppositional defiant disorder is to conduct disorder. It's like a worsening of the thing. So how do these three, well, let's just talk about ADHD and oppositional defiant disorder. How do you find they intersect in terms of the children you've seen?
Well, I think a little bit when you're thinking about ADHD and kids, a lot of times, the defiance might start off as a way to compensate for these things that they're not doing well. If they're always kind of getting in trouble for this impulsive behavior and parents aren't understanding where it's coming from, or that they might need different parenting styles, then they're going to start to deny, no, I didn't do that. No, I didn't do that, right? And then it's going to come across as lying, and kids start to believe what they're told about themselves, right? And you can kind of see that escalation. And so that's kind of where I've noticed like beginning stages of that, where kids will deny impulsivity because they know that they're going to get in trouble.
So we hear out there sometimes folks saying sugar causes some of the behaviors we're talking about. What do you have to say about that?
So what I usually explain to parents is, well, sugar is going to give any child energy. It's going to give any person energy because it's one of the main sources. And if you have propensities toward impulsive behavior, hyperactivity, or defiance, you add an energy source to that, you're probably going to see more of it. But it's not causing it. Sugar's giving them energy the same way it's giving anybody energy, but it's not necessarily causing those behaviors because you see them also times when they don't have sugar. And it's not that's not the main causal agent. It's just amplifying something that's already there.
What about food dyes? You hear that too?
Yeah, I've heard that, and I've had, there was a rare instance where maybe someone has a very unique food allergy to a very particular type of substance, but what I usually say to families is, well, let's look at it in the bigger picture and see if they only display these problematic behaviors when they've had some item that has that food dye, then maybe we should look into further testing and evaluating for that particular allergy. But if that's not the case, and typically it isn't, that you see the problematic behaviors occur in a wide variety of circumstances, not just when they've had that particular substance with that food dye, then it's pretty clearly that's not the main cause either.
Dr. Badney, you referenced this briefly before, that this group of children can sometimes also have learning problems. Can you elaborate on that a little?
Sure. It's not unusual to see a combination of behavioral symptoms as well as problems in learning in different subject areas. Mostly reading is what we get referrals for. Kids that are having challenges with their reading fluency, reading comprehension. And a lot of times the other behaviors that are associated with that is not paying attention in class, or maybe defiant to some extent, especially on task demands for that particular subject area. Typically, what we would do is what we call a functional behavioral assessment, where we meet with the parents, we meet with the teachers, the child, we explore all different options as to what might be influencing both the academic and the behavioral issues that we're seeing at school, and we ask about what's going on at home. Sometimes we get other information other than inattention or distractibility or defiance, but we learn about the family dynamics as well, which could be influencing. There may be a family that's going through separation or divorce, so we factor all those areas. So it's really a multifaceted evaluation that we're looking at in schools, and not one thing or another, but looking at the whole picture. And from that we can help determine, especially through our evaluation process, through our assessments that we administer, all the materials and records that the school has developed through their progress monitoring and children's academics and behavior. And from there we can determine whether or not there's any type of specific learning disability or other educational disability that might be impacting their learning.
So in addition to learning problems, we sometimes see, internalizing symptoms. Sadness, anxiety, that kind of thing. Megan, any thoughts about what that looks like in children?
What I think is really interesting about children that have ADHD and suffer from anxiety and things similar is the processing of emotions within their brain. It can be chaotic, and it can be confusing for the children. So it might take a little bit longer, or possibly a different type of way to address emotions with the kids and to teach them emotions, and a lot of interoception training.
All right, so you guys have other thoughts about anxiety and mood problems that you see with these children?
Well, I think you do see, that oftentimes the mood is affected if the longer any one of these problems has gone on without any kind of treatment or intervention, the more likely it's going to start to affect that child's self-esteem, their sense of self-worth. And so certainly if those things are being negatively affected, it certainly can give rise to depressed feelings. And so, in the assessment, you certainly would look for that. And if that's coming along, it may not be the primary problem, but it's kind of a secondary effect of not getting intervention for stuff that you really need it for.
Yeah, and I think too is putting yourself in these kids' shoes and going to school every day and being taught and trying to learn, and really a lot of times the routines or the techniques that they're using, are incredibly helpful for most kids, but kids with ADHD might need a different routine or a different set of skills in order to learn the material. And so really every day you're asking these kids to go into school, if they it's like writing with your left hand if you're right-handed, and that's incredibly frustrating. So it makes sense then that you're going to see anxiety, depression, because to have to go into a school setting every day and be frustrated, it's going to cause some irritability.
All right, so this is a complex array of problems that kids can have, very, very alarming to parents, concerning, worrisome. So many parents talk about this is the top stress in their life when they have a child suffering in this way. So let's say they decide to see a mental health professional. Assuming that mental health professional practices in a science-informed fashion, what kinds of things might they expect to have happen?
Well, I think your ideal assessment has multiple phases to it. And the first phase would be sitting down with the family and child, interviewing them, gathering information regarding developmental history, medical history, just a broad clinical interview. And then if it, in the course of that seems like one of these things is a concern, then the next step would be giving them some rating scales to fill out to kind of get a little bit more normative based comparison for what they're seeing compared to what others typically see. And if you're talking about ADHD, the next thing that I found extremely valuable is to do some direct testing of their attention with one of the continuous performance tests of attention on the computer to get a little bit more objective look at how are they comparing to others their age. Again, you're not going to do all that in one visit. You kind of want to maybe space that out over a couple of visits, but I think that's a good comprehensive way to begin narrowing down what we're looking at.
What about you, Dr. Kukovich? What do you do in your practice?
So I think it depends on the age too, depending on how you're doing the eval. Typically also you want to bring the parents in and come up with some type of reward system for the kids once you make the diagnosis, and be able to figure out what works for them, and being able to do token economies, so where the kids can earn things versus punishment. Because I think one of the first things that we think of when parenting is, taking something away, and that's going to motivate the kids, but especially kids with ADHD, you want to give them something to be able to work towards and motivate, and to be able to say, okay, if you earn, so it's with younger kids, you do a sticker system. With older kids, you might have like coins or something else, but to say, okay, if you earn 5 stickers at the end of this week, then you can pick out, you can have a bunch of toys from the dollar section of Target or Five Below or something, right? And they're in a bag. At the end of the week, you can pick out something from there. For smaller kids, more immediate rewards, so that they're able to kind of put that together quicker and make that connection quicker.
Yeah, we're going to do intervention more here in a moment too. So, Dr. Badner, Dr. Schuster mentioned behavior rating scales. Can you explain to people the value of those?
Yes, behavior rating scales are standardized, and what that means is they are administered in a particular fashion that is specific as to how to do that, and also they're well researched and normed on populations similar to the child that it's being administered to. There's broad-based, there's specific ratings, different kinds of rating scales, and a lot of times you want to target whatever that concern is. So, for example, there's a Connors rating scale, which is specific to ADHD and other related behavior issues with it, or behavior assessment scale for children. Those are fairly common scales that you would see. Also, there's rating scales for executive functioning. So there's various different scales depending on what the concerns are with that particular
So sometimes, I remember once in Chicago, I had a mom say, if Huckleberry Finn were alive today, we'd slap an ADHD diagnosis on him and pump him full of drugs. And I thought that was fair commentary, but what you're describing accounts for that, because we're going to compare that child to other children of the same sex and age group and see if the behavior is unusual.
Right.
And it has to be more unusual than about 93% or so of their peers before we start thinking about diagnosing. I think parents are sometimes concerned that we have hair triggers when it comes to diagnosing what might just be, a bad week or a bad quarter for a kid. But the rating scales are designed to accommodate for that, as are the computerized tests you mentioned, the individual interview, the family interview, and a collection of records. So an evidence-based evaluation is very thorough. All right, let's shift to intervention, because we could talk for hours about that. I'll take these. We'll do ADHD separately from oppositional defiant disorder and conduct disorder, and then maybe the other ones also, because I know a lot of times parents get confused when they're getting several kinds of interventions for what is treating what, and it's important to understand that. So how do you treat ADHD?
So the first thing we look at is if it's you've clearly made the diagnosis and they're definitely displaying all the clinical characteristics, and it's affecting their functioning. One of the recommendations I frequently make is let's look at medication, because there's been hundreds of studies that have documented its effectiveness. It's certainly something that's worth looking at. And if you've done the type of assessment that we were talking about, then you have some baseline data to which you can then later compare once they've started the medicine and been taking it for a while, and maybe redo some of those things and see, okay, let's see where you are now compared to where you were, and are we getting progress on those Those exact symptom areas. Are you more attentive? Are your teachers seeing is more attentive? If we do, one of the things about the computerized tests, you can do them again. Are your scores improving there? If everything is trending in the right direction, that's really a good sign that the medication is working. And it's again, if you've been correctly diagnosed, it's addressing the underlying neurological basis for a lot of this.
So I'm going to make a comment and then ask you guys to react to it. The research I'm looking at suggests that behavioral interventions for ADHD can't get anywhere near the level of effectiveness that pharmacological interventions can do, like medications. What are your thoughts about that? Because I know sometimes parents say, well, maybe I should do the behavioral treatment for the ADHD and see how that goes, when the science suggests it's...
It's frustrating for parents, and I empathize with them and say, I understand. I mean, nobody wants to feel like they have to put their kid on medicine, but the research is pretty clear, and it doesn't mean we can't do behavioral things as well. But our behavioral interventions are going to have a much greater chance of being effective and helping with longer lasting change of habits if they're have that impulse control, something on board to kind of help them manage some of those neurologically driven stuff that's just really hard for them to control otherwise.
What do you guys think?
Some of the things we're doing in schools now is helping teach self-regulation skills and self-monitoring skills for kids, especially at the elementary levels. And there's some really nice curriculums out there to do that. So, and the teaching of the self-regulation, self-monitoring skills is depending on the school district. It could either be done in individual classrooms or sometimes school-wide. And when it's school-wide, it's typically part of an MTSS, which stands for Multi-Tiered Systems of Support, where there's basically 3 different levels: Tier 1, Tier 2, Tier 3. Tier 1 is considered universal supports. That's for all kids. Tier 2 are for those that are maybe struggling a little bit in a particular area. And Tier 3, even more individualized or small group support for them. And it could be targeted for not just academics, but for behavior as well. So all kids are getting these universal behavioral supports and learning these self-monitoring, self-regulation skills in that setting. And then the ones that are maybe struggling a little bit, we're able to determine which areas they're struggling in, get them a little bit more support. What it also does is it provides a common language for not just the children, but the teachers, the staff, the administrators, and the parents, because we teach the parents about this as well. So in addition to whatever interventions are happening in a therapist's office or medications that are being employed, kids are now learning a framework on how to regulate their thoughts and their emotions within the school setting. So all the reward systems that Dr. K talked about before, schools are a great resource for parents for that as well. Use a lot of incentive-based, performance-driven supports in schools for kids as well.
So let's segue to children who are defiant. What are some, Dr. Popovich, you started to talk about this, what are some interventions behaviorally for those defiant kids?
So, with defiant kids, one thing that I'm looking at is the relationship with the parents when they come in, right? We're all overworked, we're all stressed, we're all exhausted, right? We have a million things going on. But looking at, are you spending quality time with each one of your kids individually, right? And again, a lot of times it's not, that parents don't want to be doing it. It's just that there's so many things you have to do in a day. So really sitting down in the office and helping out, carve out moments. It doesn't have to be hours and hours, but 15 minutes, right? Half an hour. How can you spend individual time with this kid and build their self-esteem? Positive reinforcements. And typically, if kids are having a more difficult time following through with instructions at home, use shorter commands, right? Instead of saying, I want you to go clean your room when you're done with this, and typically that's because we're stressed out and we have a million things going on in our brain, and so we have all these tabs open, and we're just like throwing that onto our kids, not realizing that they might not be able to do that just developmentally where they're at. So shorter commands, right? Hey, can you put that book away for me? Or I love that you're reading that. As soon as you're done, will you put it back in the cabinet for me? Small commands like that, and kind of looking at those things. And then, like I talked about before, the token economies really help. Cognitive behavioral therapy, there's something that we do as parent training, and so that kind of helps parents learn the best interventions for kids and how they can utilize the time that they're spending with their kids and utilize some of those techniques.
Megan, any thoughts about this?
Something that I like to remind parents of during my work in ABA is to reinforce the behaviors that you would like to see. Typically, I feel when we're constantly pointing out the behaviors that we do not want to see in the children, it's kind of, adding more stress to them, and they've already got a lot going on. So reinforcing the good behaviors that you'd like to see is often what I like to tell people.
So we only have a couple minutes left, but Dr. Kukovic mentioned cognitive behavioral therapy, which, while maybe not useful for ADHD or defiance, is very useful for things like anxiety and depression in children. Can you give our viewers a sense for what's involved with cognitive behavioral therapy in a couple minutes?
Well, I think what you'd want to focus on with the child is a couple of things. Again, I'm assuming the child has depression or anxiety in addition to one of these diagnoses. And so you'd focus on how are they looking at things, first off? What are their thoughts, their beliefs, their expectations about themselves, about situations? And one of the things I try to help them identify is, are there some errors in your thinking there? There's some ways that maybe you're looking at it that are making it far more anxiety-provoking or far more upsetting than maybe it might otherwise be. And then we kind of brainstorm what maybe would be a better way to talk to yourself about that, to think about that, what would be some better strategies to employ. And it can involve rehearsing that with your psychologist, working on practicing it before you try it out in the real world. In a nutshell, those are the kind of things that you'd focus on, is helping them to identify what are the things that trigger those feelings, and then how can we change that.
Yeah, a lot of that is the tenets behind the self-regulation training programs that we're utilizing in schools as well. It's a blending of the cognition as well as behavior, bringing that to light, open lines of communication with all parties, and keep things consistent, short, to the point. And
all right, so let's you each have a closing thought as we have a couple minutes left here. Dr. Schuster, closing thought for people?
Yeah, I think the number one thing I would say, anybody watching, is that if you suspect any of these concerns for your child or a loved one, that it would definitely be worth pursuing an evaluation. If there is one of these disorders, there's certainly help out there, and there's lots of things that you can do. And if it's not, a good thorough evaluation will tell you maybe it's something else. Maybe there is some other problem or issue, and go after that. But it's certainly well worth the time it might take to evaluate it properly.
I would say to a certain extent, a lot of us in this day and age are experiencing ADHD symptoms with a very chaotic mind. And so whether you're concerned about yourself or your child possibly having ADHD, one step could be practicing mindfulness with you and your child, and I think that's a really great step even before seeking treatment.
Thank you.
Early intervention. So, the earlier that we can intervene with ADHD, defiant behaviors, the better outcomes there are in adulthood. And so I think if you're a parent, if you're noticing something, right, you're the expert on your kid and you know when something's off. So seeking that early intervention and being an advocate, right? Talking to their teachers, talking to other caregivers if they go to camps, if they go to after school programs, educating them on what's going on with the kids. So early intervention, I think, is key.
yeah, I would mirror that as well, and parents, reach out to the schools because they're a great resource for you as well, and they also have lines to local therapists or psychologists that could potentially work with these issues So it's a good overall resource. And you also want to be aligned with your school, especially if you're looking at these kinds of concerns.
Thank you all for being here today and sharing your expertise. That's it for this edition of Mental Health Matters. I want to thank Dr. Schuster, Ms. O'Brien, Dr. Krakovich, Dr. Badner. I also want to thank the student production team behind the scenes here that have been very helpful. Novica Molinaro, Lindsay Jason, Colby Hughes, Corey Lab, and Kyle Driscoll, as well as the master and commander of all things here at Marywood Studio, Mr. Ernie Mangoni. That's it for today's edition of Mental Health Matters. Please tune in next month when we're going to be covering family dynamics and all the ups and downs of that considered chaos. Thank you. Please remember, mental health matters.